Being open-minded as a psychologist is a very good ability. And I haven't always been very open-minded. In 2004, a colleague told me about the technique that he said works on almost anything. All kinds of psychological things, and also on pain and even allergies. I became very skeptical. I said, no, not possible. There's nothing that works on everything like that. But I was curious. I asked him, well, what is this technique? What do you do? What you have to do? I said, it's very, very simple, he said. You just have to tap on different places on your face, and then you have to roll your eyes and hum and count. I said, really? Psychologists don't do that. We have to stay a little bit professional. This sounds like really quacky stuff. No, it really works, he said. No, I don't want to have anything to do with this. And I forgot about the whole thing for 5 years, until 2009. Then I had been giving a course for a lot of people, and I had just taught them the so-called swish technique, which is a very fast reconditioning technique. They were all very enthusiastic, and when we took a break, a woman came rolling up to me in her wheelchair, and she told me, you know what, you like these quick techniques, you have to learn the technique that I use to control my pain. I said, really? Control pain? And I would want to control pain because I had a lot of depressed people who were depressed exactly because of their pain. I said, okay, you have to tell me about that. What do you do? Well, you know, I have this technique. I just tap on different acupressure points in my face and on my hands, and the pain goes away. I had a little bit problem keeping a straight face because it was exactly the same technique that my colleague had told me 5 years earlier. So I said, wow, that's good, but what happens if you don't do it? Well, if I don't do it, I couldn't be here, she said. I would have to eat painkillers like candy, and I would be totally groggy. But now, if the pain comes now, I can control it. Because, you know, the reason why I'm sitting in a wheelchair is that I have hernia in my spinal column. So the nerves actually come out between the vertebrae, and it's extremely painful. Oh, so it sounds impressive. So I went and I checked out the technique, and I actually saw that they had done research on it, and that would be my reason for using a technique, is if I could know that it had been used in research. And it had been, and the research had been registered in the Cochrane database of controlled studies, and this is a very strong quality stamp. And what they had done it on was on phobias for small animals down in Australia, and they had found out that with this technique they could treat the phobia 3 times faster and get results up to 80 or 90% of the patients. With standard cognitive therapy, it took 3 times as long, and they got 60 to 70% good results, which is quite impressive anyway, but it's nicer to be able to do it faster. So, okay, this technique seemed impressive. So I said, okay, but I have to try it for myself. And luckily I had a bit of pain, so I tried to define the pain as precisely as possible, and this is the point with the technique, the wording matters. So when I said just pain in my back, it didn't work. If I said burning pain right over my right hip in my back, burning pain right over my right hip in my back, burning pain right over my right hip in my back, then it worked. So you have to be specific. Okay. So I made it work on pain, and it was very impressive. I tried to rate the pain before it started, like it was on 6, and then on 1 round it was on 4, and 2, and then often 0. And this is very impressive when you can get your pain to go to 0. And you have to try to believe it. You probably think that I'm totally nuts believing in these things, but okay, try it and you'll see. But I hadn't tried it on psychological things, and after all I'm a psychologist, so I wanted to see if it worked in psychological things. I was a little bit apprehensive to try it on a patient directly, so I did it in a course where I had a woman who was extremely sensitive and very afraid of closed rooms. She couldn't sit behind a locked door. And everybody in the course knew that she couldn't sit behind a locked door because she would sit and hold the toilet door when she went to the toilet. And I said, okay, you want to try? Yeah, she was willing to try. So how would you say what you're afraid of in a very simple sentence? And she said, well, yeah, I think it's just I'm afraid of sitting behind locked doors. Okay, I said, we can try that. And then we did afraid of sitting behind locked doors, afraid of sitting behind locked doors, afraid of sitting behind locked doors. Okay, and took 1 minute with the rolling of the eyes of everything. I'm going to show you on the end of this video and on the next video. She went, I asked, you can't be cured with just that? She said, yeah, I think so. And I said, well, let's go and test it in the toilet that you had been just holding the door before. She said, and we went, everybody in the course went behind me. She went into the toilet, she closed the first door, locked it, then she went into the stall and she locked the stall also. I said, wow, impressive. Then she came out bright as sunlight with a bright smile. I said, yeah, no problem. And then I said, okay, but you had also phobia for being alone in an elevator. You want to try that? Yes, of course. So she said, afraid of being alone in an elevator, afraid of being alone in an elevator, afraid of being alone in an elevator. 1 minute, and she said, I think I'm over it. And we went to the elevator and she took the elevator alone for the first time in her life. Okay, 2 more short stories. Another one was with a woman who had extreme pain in her right arm. She hadn't been able to lift it higher than this. And it was a course with many participants, and I said, do you want to try to get it away? Yep, she said. And with the other hand, she defined the pain, aching pain in my right shoulder, aching pain in my right shoulder. We went through it once. It went from 8 out of 10 to 6 out of 10 on a pain scale. And then next one, it went to 4, then to 2, and then to 0.5. And I said, maybe you don't want to give up your pain, maybe you get some sympathy from it. No, we would try one more time, she said. Okay, we did one more time, and then she said the pain was 0. And I always get a little bit suspicious when people say the pain is 0. So I said, okay, but the proof is if you can now move your hand. And I said, don't push it if you feel pain, it's not good, don't push it. So, but just try to lift your hand. And she lifted her hand, and she said, oh my gosh, oh no, I can't believe it, this is fantastic. Oh, I would never have thought. And she lifted her hand completely without pain. Very impressive. So then I got really inspired. So when I asked the participants to try the technique on each other, then I saw one woman who was very stressed, just trying to explain it to a colleague. I said, you get stressed when you try to explain things to people? Yes, she said, it's my fear, I can't do these things. So then I said, oh well, great, then we can test the technique on you. Do you want to come in front and then we can test it on you? Okay, she said. And then I was a little bit too quick. I thought I knew what was her thing. So I said, okay, you're just going to knock on these points, and we'll see what happens. So you just say, I'm afraid of presenting things for others, I'm afraid of presenting things for others, afraid of presenting things for others. And when you say the fear, what you're afraid of. And I thought it would work. And it was on 6 out of 10 before we started, and when we were finished, it was still on 6 out of 10. Very embarrassing. So I suddenly remembered, no, but I didn't ask her what was her thought that triggered it. And I said, well, what are you actually afraid of? Dig a little bit deeper. What are you actually afraid of when you're going to present things? I'm so afraid I'm going to forget what I'm going to say. Aha, then we try to do it on that. Afraid I'm going to forget what I'm going to say. Afraid I'm going to forget what I'm going to say. Afraid I'm going to forget what I should say. Etc. We went through the technique with that. And it went from 6 to 4, 4 to 2, and then 2 to 0 on the third round. And I said, really, 0? You're not afraid at all anymore? Nope, she said. Okay, good for you. Then you can have a presentation about EFT, as it's called. And she stood up and she had a presentation in front of 25 people without hesitation. And at the end of the session, she just looked at her hands and she said, I'm not even sweating in my hands, I'm not even sweating in my hands. Because this was her typical symptom of anxiety. So the lesson to learn from that one is, if one thing doesn't work, try a different wording. And especially if you're going to do it on other people, ask them how they would say it. And this is the technique. I had a very strong demonstration of this with a patient who was very afraid that his heart would stop. So I thought that the thing that he should do it on is afraid that my heart is going to stop. So we did afraid my heart's going to stop, afraid my heart's going to stop. And it was on 7 out of 10 before we started, and it stayed on 7 out of 10. And I said, seems like this didn't work. Can we try a different wording? I said, okay. So I said, but how would you express it? Yeah, it's an anticipation that the heart is going to stop. I'm not really afraid, but I think it's going to stop. Okay? So then I say, I think my heart is going to stop. So we did. I think my heart is going to stop, I think my heart is going to stop, I think my heart is going to stop. We went through it once, and it dropped from 7 to 3 out of 10. And I said, yeah, great, okay, now we got the right sentence, let's do it again. And then he forgot, and then he said, afraid my heart is going to stop, afraid my heart is going to stop. And it stayed on 3, it didn't move 1 inch. And then I said, no, but remember, you said this, the sentence that didn't work. Try again with, think my heart is going to stop. Think my heart is going to stop, think my heart is going to stop, think my heart is going to stop. And it went to 0. So the wording matters. Let me just go through it once at the end of this video, and then we take it again in the next video. First, you're going to say that you accept yourself even if you have the problem. So, even if I'm afraid of X, I accept myself completely. Even if I'm afraid of X, I accept myself completely. Even if I'm afraid of X, I accept myself completely. And then we go on the points. Eyebrows, even if I accept my X, so afraid of X. So afraid of X. So afraid of X. Under the nose, so afraid of X. Under the mouth, so afraid of X. Collarbone, so afraid of X. Under the arm, so afraid of X. Then the fingers, on the outside of the fingers, near the nails, so afraid of X. I'm 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 so afraid of X. And this one, I'm so afraid of X. And then it's the strange things. It's up here, between the ring finger and the little finger, and you tap like this, and then you close your eyes, open your eyes, then you look down to the right, you go down to the left, I do it opposite now so it's easier for you, and then you roll your eyes from the roof to the wall, down to the floor, up to the roof again, and then the other way. Roll your eyes, and then comes the weird part. You're supposed to hum, so I hum Twinkle Twinkle Little Star, but just hum, don't say the words. Na, 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 na. Then you count to 5. 1, 2, 3, 4, 5. And then humming again. Na, 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 na. And then it's the same knocking sequence again. I'm so afraid of X. I'm so afraid of X. I'm so afraid of X. Tap lightly. So afraid of X. So afraid of X. So afraid of X. Under the arm, so afraid of X. Fingers, so afraid of X. 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 And so afraid of X. And there you've done 1 sequence. And very often the anxiety will drop like 2 points out of 10 for each time you do it. So you have to do it again. And you can do them one after the other. You don't have to take any break. It doesn't matter if you do it on the right side or the left side. Just follow the points. Okay, so you see it looks kind of weird, but it's a very interesting technique, and you can find heaps and heaps of videos on EFT on the web, on YouTube. Okay, so the next video I'm just going to do the sequence so that you can do it by looking at the video.